So the yellow wallpaper is probably the most well-known short stories or pieces that it's kind of Charlotte Gilman Perkins Gilman's claim to fame. I know that a number of you have already read it, but The Yellow Wallpaper, she published the year of her divorce in 1897, and she gave it to the Atlantic Monthly, and the editor sent it back because he said that he wouldn't publish it because he found it too personally distressing, which I think is kind of interesting. But that kind of I want to talk a little bit about the historical context of the yellow wallpaper. These are kind of things that you need to know in order for the story to make a little bit more sense, because the longer it goes on, the crazier it kind of gets. So there are three kind of things that go hand in hand with the historical context of our story. And I mentioned earlier that Charlotte Perkins Gilman is writing during the Victorian era, and she's writing against some of those established ideas present during that time. And one of those things is men and women and the separate spheres, hysteria and the rest cure. But separate spheres comes out of the new middle class that did not have to make what it needed in order to survive. So, in other words, men could work jobs outside of the house while women and children stayed at home. Women, the belief was that they could fall prey to the temptations, violence, and trouble of the outside world, and they needed to be protected and isolated from that. And that idea of two separate spheres created a new ideal for women, an ideology about the home. And it helped develop this idea of the cult of domesticity, or the cult of true womanhood. And part of that relies on this idea that women should be pious and have a propensity toward religion, purity, which is the opposite of a fallen woman, one that was not sexually promiscuous, that they were encouraged to cover body parts on all things, legs to limbs. Men and women's books would be separated on bookshelves because there was women work and the more serious uh, male work that women's brains just couldn't understand. And this is where also we get this idea of cabbage patches and storks, because you don't want to talk about the impure idea of sexual relations between the sexes. But I digress. Submissiveness, in that women should be I guess in some measure a dependent on men. They need a protector. Um, a woman needs to ask for help with wisdom, constancy, of firmness, and also this idea of domesticity, where needlework, crafts, wifely duties, childcare, keeping the home a cheerful place, which would attract men away from the evils of the outside world. So, really, they lived a life of, if you were in the kind of upper middle class, like our character in this story is, and certainly Gilman was herself, there was it was a life of leisure and luxury rather than of production, I guess is the word that I'm looking for. In other words, too much leisure and too much luxury can lead one to become depressed, because there's nothing to do. Every day is the same, and I think that we can kind of feel that way with the COVID um, happening. But um, hysteria stems from this kind of cult of domesticity, and hysteria is a broad diagnosis assigned to women who displayed too much emotion or demanded too much attention. And a lot of that comes from because of the separate spheres and women not being able to do what they do today, I guess, being kind of stuck in the same kind of place. There was an numerous or increasing kind of mental pathological disorders among women, and hysteria becomes this kind of quintessential female malady, believed to be a mental disturbance associated with the womb. The Greek word for womb is hystera in Greek, and it means wandering womb. If you're familiar with that, but anyways, hysteria and femininity become co-terms, standing for extreme emotional states. So, in order to treat hysteria, and depression would have certainly encompassed this idea of hysteria. The rest cure was prescribed, and it would treat all sorts of mental disorders, and it was developed by the guy I mentioned earlier, Dr. Vera Mitchell. And this doctor was very well aware that the rest cure was a rather, quote, very bitter medicine for patients whom he probably didn't really see as sick or suffering, just spoilt and restless. And women were meant to be cured by restoring them to a properly passive role or subordinating them to an enlightened but dictatorial male will. And it ultimately forced into a childlike dependence the patient. Anyways, it forces them into like this childlike dependency. And the way that it works, the rest cure, it worked by complete and total bed rest, bed rest that was extended, isolation from, oh gosh, my cat's off in the knocking my papers off. Isolation from family and familiar surroundings, overfeeding, especially with cream, on the assumption that it increased body volume and created new energy, and massage, which was a polite way of saying electric shock, because it was meant to kind of jolt them out of their melancholy, as it were. But this rest cure, which certainly would have been prescribed, it was prescribed to Gilman after she had her baby and was suffering with postpartum depression. And the rest cure is what our narrator is in the yellow wallpaper. Our main character, our narrator, our unnamed narrator, is undergoing at the behest of her doctor husband, John. So the rest cure was seen as both a treatment and a punishment, because, I mean, women disliked being placed on rest and were likely to become hysterical again. So those are the kind of historical context that I want you guys to keep in mind as we read through the story. Some other things that I want you guys to look at and be aware of is that, again, we have a first person narrator, and pay attention to how the narration and how the character herself changes from the beginning of the story to the end, because her story, she's telling her story, but it becomes, the longer she is kind of on this quote unquote rest cure, the more fragmented the story becomes, the more inarticulate and less understandable the story becomes, because very clearly it is about the mental deterioration that's going on with our character. Pay attention to the relationship that she has with her husband, John, and how he treats her, and what she says about him and their relationship. I want to draw your attention to some symbols. Obviously, the yellow wallpaper, the titular kind of symbol of the story, but also things like moonlight are important in times of day and things like that. And then, of course, the woman in the wallpaper. And if you've never read this story and you haven't yet, you'll know what I'm talking about once you get there. So pay attention to those types of things. And we'll talk about those this week when we come together. So I'm going to stop this one more time and pick up with my kind of last little spiel about Susan Glaspell.